it's on digital transformation. In the morning, we had from Professor Rita, who presented very well on the same, but now we want to hear from the ARISE fellows, especially the projects that they are going to undertake. And we'll give them, I'm told, 5 minutes. I don't know whether that is enough, but if we have to go overboard, perhaps only 7 minutes. So I want to start by inviting the one who is online. Do we have Sandra online? Sandra, are you there? For online participant? Hello? I think we are not yet connected. Ah, there we are. Sandra? No? Okay, if we don't have Sandra for now, can we have the other online participant, Haja? I hope I'm getting the name correct. Haja, are you online? No, I think so far I can only see Professor Rita. Okay, if we don't have those ARISE fellows online, then we can start with Emna. You have the floor.
Thank you. So hi everyone, my name is Emna Hriga, I'm an ARISE fellow, and my presentation today, do I have something to, to move my slides? I need to move my slides. Thank you. So, and I'll be presenting my work about artificial intelligence for drug discovery against infectious diseases. So I'm not going to talk too much about how important to have new drugs against infectious diseases for Africa and African diseases, but I'll be more speaking about how computer-aided drug discovery and computational approaches can help enhancing and leveraging the whole process of drug discovery. So this is the framework for my BIND projects. It's mainly about innovative computer-aided drug discovery against infectious diseases, but also developing new technologies based on artificial intelligence for drug discovery. And I'll be focusing on my activity number 3, which is AI approaches for ligand-based drug discovery, considering that drug discovery is a low data domain, which means that data is most of the time lacking, and data is the first step and has a central role in the process, as we start by collecting the relevant data to the project that we are trying to conduct in. So here I can have the laser. So here it's basically data on molecular targets or chemical entities that have an interest to be developed as novel drugs that we then encode into binary vectors in order to be fed to different machine learning and deep learning algorithms that will then be learning like a human brain in order to recognize whether a molecule should be active or inactive, or sometimes we can use them to develop new knowledge like, de novo drug discovery and predicting some properties of the drugs. So as everything starts with data, we have started through a project called AIR2D2, Algorithms for Integrated Repurposing and Repurposing of Drugs, that have been funded by the USAID and the National Academies of Science of the USA from 2019 to 2021. And through the project, we have been doing a massive work in order to collect intensive data about molecules with anti-pathogen activities. First, we started with malaria, and then when COVID-19 hit, we have been focusing also on coronaviruses. So basically, we did a lot of research, constructed a database that we call CDOS-DB. And then we are, hopefully we will be soon launching CDOS-DB as an open source database for the whole community that is easily browsable, and when people can really use the data that is in there, but also use an embedded machine learning functionality that I'll be talking about right now. So we had the data, and then we needed to start thinking about how to use it in order to validate how machine learning or deep learning algorithm will be a good approach for drug discovery. So we had for coronaviruses more than 3,000 molecules at the start that went down to 2,600 molecules, which is a low amount of data for deep learning algorithm. And our objective is really to go and validate how deep learning algorithm would be a good venue for drug discovery. Also, we had, although our data set was chemically diverse, still it was heterogeneous as the data came from different research and had validation experiments on different types of viruses or molecular targets, and is a small data set. So our question, how good deep learning algorithm would deal with this type of data, which is still a big data set in terms of drug discovery. So we first encoded our data to make them resemble to binary vectors. We used molecular fingerprints to generate the input for 7 machine learning algorithms, and graph convolution approaches to generate the input for 4 deep learning algorithms. So in total, we had 11 AI models that we trained and then assessed their performances in classifying the molecules into active or inactive against coronaviruses. So once we had this, once we had this in hand, we have identified the most interesting deep learning algorithm, which are DAG and GCN. And we kept random forest, RF, which is the baseline machine learning algorithm to which we will be comparing things. So up to the first steps, we still have machine learning outperforming deep learning algorithms, which is quite normal in the first stage. But still, we have been optimizing our neural networks. So both of these are deep neural networks based on graph convolutions. And the idea was to optimize all their hyperparameters in order to make them best performers. So we have these performances, that's good, but it is always not sufficient in order to say we have a good model. So an important property of a model to predict is to make sure that it has a good generalization power, which means once you move to real data set from real life, it will still be a good performer. So this is what we did. We have been splitting our data set into different categories, training on a subcategory and testing on the other one, making sure that there is no bias within the data. Then we moved to the last step of our work, which is an external validation of the performances, where we have took a PubChem assay on 1,500 validated FDA drugs that have been tested for their effect against SARS-CoV-2 infected cells. And only 17 molecules were active. So keep in mind it's 17 among 1,500. And then using our deep learning algorithm, we were able to classify with GCN 8 out of 17 as active molecules. This is a huge true positive rate in drug discovery, as a lot of screening would go out with almost 0 true positive rates, even if it's experimentally or in silico. So this is really indicate how deep learning algorithms are outperforming machine learning in terms of generalization power, and also demonstrate that we really can rely on such approaches for drug discovery. So these are the fundamentals that we are starting with to build our BIND, which is the ARISE project that will be funded by the AAS. Our deliverables are both the data set that we have, the database and its interface, but also all the machine learning that have been published and are made open source in 2 publications already, one on COVID-19, the other one on leishmaniasis. Both appeared in 2021, 2022. So the take-home message is that data is central, and it's always very important to pay attention to data and how we analyze it before we move on to developing any AI technologies. So I would like to acknowledge all my team, namely Mohammed Wuld Mouloud and all the team behind this project, the funders, my lab, and you for listening. Thank you.
Yeah, you can keep your questions until all the presenters have given their presentation. And yes, please. Okay. There was an Arise fellow. I don't know whether she's not. Yeah. Now, can we have? Very good, thank you. Can we have Sandra make your presentation? We have 5 minutes. We'll give you 5 minutes. There you are.
Hello, everyone. Do I share my slides or will someone present them for me?
Yeah, you can share. Oh,
okay.
The microphone. Did you hear me?
Yes, I did.
Yeah, please. Thank you. Go ahead.
Great. Thank you, everyone, for giving me this opportunity. My name is Sandra. I'm one of the Arise Fellows, and I'm going to be sharing today my project, which is looking at implementing a mental health literacy e-curriculum in Malawi universities. Just to give you a quick background, so in terms of the scope of mental health in Malawi, depression and anxiety, as you know, are pretty common among young people globally. And when you look at Malawi, current depression prevalence rates tend to stick around the 20 to 30% range for adolescents and young people. But unfortunately, in the country, knowledge and attitudes towards mental health are pretty low, and this fuels a high stigma with regards to those who have mental disorders. But also, coupled on top of that, resources to address mental health conditions are pretty limited. The government allocates 1% of the healthcare budget to mental health services. If you look at the table over there, the whole country has got only 3 mental hospitals. All are situated in the cities, which means people in rural areas are neglected. There are no outpatient facilities. There are no formal treatment programs for young people, children, adolescents, etc. And when we look at data that's being collected around mental health and related issues like substance use, there isn't really much being collected. And then when we look at the mental health workforce, again, it's very critically low, in that we have 4 psychiatrists in the whole country that serves 19 million people. And the most prominent mental health workforce, you'll find there mental health nurses, but then even for that, you have about 1 nurse to 100,000 people within the population. So since starting my fellowship, we've conducted a few scoping projects. So I'll just report some key findings. So we've done 4 qualitative studies. One was a community public engagement project, and the others were 3 student projects that I supervised, so master students, and they were a blend of focus groups and interviews. And the key findings that we identified were that there's high burden of mental health problems among young people, and the coronavirus pandemic has made existing mental health problems worse. The low mental health literacy is still persisting, and people tend to prefer to use traditional healers or faith leaders to deal with mental health problems and disorders rather than going to a health service. There's also a lack of words to properly describe mental health conditions in our local language, and this further limits understanding of particular conditions. There are also limited places for young people to seek help or to openly feel safe to talk about any type of mental health distress they might be feeling. An achievement of this work is that actually we've been quoted in The Guardian on an article that was talking about the failure of the health services to cope in Malawi following a surge of mental illness among young people. We also conducted a national survey where we had a mental health literacy scale that we got young people in community settings, both rural and urban, to complete the survey. One of the questions that was quite interesting there that we asked is, do you know anyone with a mental health problem? And about half of the respondents, we had 700 people respond in total. Half of them said that they did know someone with a mental health problem. And most of those people who knew that their relationship with that person was that they were either a relative or a friend. And when we asked particularly what type of mental health problem, the most common one quoted was depression, but the other most common thing that people said was just madness. So it was almost showing us that people were kind of thinking their relative or friend had an issue, but they could not describe what the exact mental health problem was. And again, this fuels into the issue of people not really understanding what mental illness is, that there's different conditions in the way that physical health, you have a cold, you have flu, you have malaria, so the diagnosis part is really a problem. And then we had some atypical answers or unusual answers. So some people would say, oh, they're violent, or they're short-tempered, or they have leprosy, which I think actually they were talking about fits, but they were using leprosy in that sense, which is again more confusion, or they just don't think well. So again, it's more stereotypical aspects of what people think someone with a mental health problem is like they're violent, they're dysfunction, that kind of thing, which is fuels a lot of stigma. And then some people also mentioned things like disabilities, like they're deaf or they cannot see, they have visual impairment. So the lessons that we learned as well from doing the survey is that the questionnaire that we use needs to be changed more to fit with the cultural relevance of the Malawi setting. For example, maybe adding even the option of I don't know to some of the questions so that we know that people are not just guessing or trying to fit into a response, but they generally can say that they don't know the answer to the question we're asking. So we used the data the insights we got from the qualitative studies and the survey to come up with an e-curriculum that looked at improving mental health literacy. So we're currently delivering this to first-year students at Millennium University. And the focus really is to look at whether the content is acceptable for young people, the delivery modes, whether it's feasible to deliver it online, and also the impact it has on the attendees' mental health literacy scores. And this is just an outline of the content. So we're looking at, we have 5 sessions that look at stigma, specific conditions, information, experiences, lived experiences of people, and how to get help and support from a very local perspective in Malawi. So what we've learned so far is that we need to extend some of the timings of the sessions. We need to be more portable in terms of devices. So like making sure we have projectors, laptops to facilitate times when we don't have access to electricity, which is a chronic problem in the country. And we also need to identify and train more facilitators to help us to be more actively portable and able to move across the different study sites. So lastly, just to finish off in terms of the emerging needs and gaps that have been identified so far throughout the fellowship program, is that the digital infrastructure for delivering this intervention can be quite hampered by the chronic issues with electricity. And this has been linked to climate change. We had some floods that just ruined our electricity sources. fuel shortages as well, which will limit our ability to move across the country when delivering this. So we need a flexible approach to intervention delivery. We've also found out that access to internet is there. People are very savvy, people like to be online, but data is expensive, and this is worse for young people. So we need more buy-in from their universities to support students to have internet access, to be able to access the e-curriculum more readily and freely. And lastly, feeds into the first part that I talked about, lacking youth-focused mental health services. We need to develop policy and services that are focused on young people, their mental health. And the way to do it, I think, more feasibly is to map onto existing structures like schools, like community centers, like local clubs to facilitate this. Thank you. I'll stop there.
Yeah, thank you very much, Sandra, for that very interesting presentation. We'll wish that you still remain online, because I believe there'll be some question and answers at some point later. So now we want to move on to the next presenter. I hope the online participant is now there also. And I think the name was Haja. Haja,
Yes.
are you there?
Yeah, exactly. I'm here.
Wonderful. Yeah, you have the floor.
I will share my screen.
Right.
Can you see my screen? Hello, are you able to see my screen? Sorry.
Yeah, we can see it.
I'm so sorry.
Yes.
Okay. So my name is Hajar Al-Hamouti. I am assistant professor at Mohammed VI Polytechnic University in Morocco. And my project deals with the internet access for unconnected and rural areas in Africa. So the main objective of my project is to provide approaches and technologies that will allow a wide internet access to populations in out-of-reach areas and rural areas through the deployment of non-terrestrial networks that are basically composed of drones, high aerial platforms, and satellites. From the starting of my since the starting of my projects, I managed to hire 2 PhD students that are currently working on 2 working packages of the projects, mainly to study the performance analysis of networks that are based on aerial networks, and also to develop approaches for optimizations for the optimization of aerial networks. So we managed to publish a work that study the deployment of drones that are used as data collectors in order to collect data from sensors that can be deployed in a city or in an agriculture field. So those sensors in general, they would collect measurements, and these measurements need to be relayed by the drones to a server that can make a decision. So our contribution was to propose an approach that would optimize the trajectory of the drone in order to collect the data in an efficient manner by respecting its the budget, the energy budget of the drone, and also by minimizing the age of the collected data. So this publication actually is in one of the top tier conferences in our field that is called the Globcom. It was with my student Mohammed Nabi NDI, and we are currently working with the other students on the performance analysis of these networks. So for the next step, I planned for my project to have a postdoc and PhD students and also master students. So I am in the process of hiring postdocs and master students in order to be able to work on the other working packages of the projects, which deals mainly with the energy efficiency and the economic aspect of non-terrestrial networks. And also we are in the process of organizing a workshop with the industrials in order to collect their, in order to discuss with them and also see their vision regarding the deployment of IRL networks in order to provide connectivity to unconnected areas. And with our research, we are continuing to work on a solid set of publications that we would like to publish in top-tier conferences and journals. So yes, this is what we did so far, and I'm happy to take all of your questions, remarks, and suggestions.
Yeah, thank you very much, Prof, for that a very good presentation of the work you're doing and what you plan to do as next steps. So we'll request that you still remain online until we go through the Q&A session later.
Yes.
So now we are back to the room. Now we can call upon Dr. Asani. You have the floor. Your presentation is also there? Yeah, please.
Yeah, okay. Okay, thank you. Hi, everyone. My name is Asani Seydou Alassane. I'm from University of Parakou. I'm assistant professor, and I'm gonna present my ARISE project titled Developing a Mobile Application for Formulating Cost-Efficient Balance and Climate-Sensitive Rations for Improving Livelihood of Smallholder cattle farmers in West Africa. You know, feed is the main limited and most expressive factor in the livestock production in the developing country. And the poor knowledge of the nutritional requirement of the local cattle breeds limits the formulation of balanced rations of these animals in West Africa. In fact, even where the quality feedstuffs are available, rations are not well formulated. Thus, animals are not properly fed, resulting in lower milk and meat productivity, potential income losses for the smallholder farmers, as well as feed wastage. In addition, poor feeding of animal causes the greenhouse gas emissions, particularly methane, which contribute therefore to global warming. The challenge today is how to maintain the balance between climate change and livestock production. Our ARISE project intends to fill this challenge by developing a mobile applications. So for our project, we have 4 web packages. And the first web package, it is about the feeding, they analyze the feeding system of small cattle farmers and mapping the availability, variability, and prices of food resources, feeder stuffs, and agro-industrial byproducts in Benin, Niger, and Togo. For the second web package, it is about the developing of a smart feeding standard and mobile app base for formulating a balanced rations for indigenous cartel in Benin, Togo, and Niger. And for the third work package, it is to determine what is the socio-economic condition required for the large-scale adoption of the innovation which is being developing in this project. And for the last work package, it is about to build the capacity of stakeholder in the use of the mobile application that we will developing during this project. So for what is the methodology that we will use for each work package? If we take the first work package, according to the, will be a survey. We will conduct a survey to among the smallholder farmers to using donc the feeding assessment tool developing by ILRI to inventory so the feed resources available in this country. For the second work package, it will be an experimental on native cattle using a Griffin system, which will be conducted to evaluate so the nutrient requirement and the greenhouse gas emissions of this animal. And then a software will be and the mobile application will be designed through the data that we will collected. For the work package 3, structural questionnaire will be administered to smallholder cattle farmers per country to identify what is the obstacle and socioeconomic condition required for the large-scale adoption of this innovation. And for the work package 4, the training and demonstration will be conducted to build the capacity of stakeholder in the use of the ration formulations for mobile application. So what is the outcome of this project? At the end of this project, a complete database, feed composition table, nutrient requirement, low cost and environmentally friendly rations, and easy to use mobile application in local language are set for better performances and sustainable cattle farming. Also, 2 PhD students and 4 master's students are so co-supervised and defended. At least 5 scientific papers and police briefs are written and published in the peer-reviewed international journal. So this is a little bit the outcome of this project. So we started with the first work package in our project, and 3 bachelor students are already defend the dissertation about this first work package, and 1 master student will defend in this month a dissertation about this work package, this first work package. Thank you for your kind attention.
Yeah, thank you very much, Prof, for giving us some highlights of what you've been doing about the research, the ARISE research, and we wish you well. Now, I think we're about to come to the end of our presentations. We have now Semedo. Yeah, you have the floor. Oh, yes.
Hello, everyone. It's okay. Okay. My name is Sonia Semedo. I am an assistant professor at University of Cape Verde. In Cape Verde, you can see, oh, sorry, black, no, light. You can see Cape Verde in the Atlantic Ocean. So I am also an ARISE Fellows, and my project is Smart Solution for Water and Agriculture to face the climate change crisis in Cape Verde. The ARISE project is funded by the European Union. No, I don't want to change right now. The Horizon project is funded by the European Union and implemented by the African Academy of Science in partnership with the African Union Commission and the European Commissions. Nowadays, everyone wants something smart. Smart water, smart agriculture, smart health, smart everything. Smart is the new trend. And in Cape Verde, we are also following this, and we are trying to, in Cape Verde, to mitigate the impacts of the droughts. We are exploring smart solutions for water and agriculture. Normally, a smart solution is composed by a wireless sensor network with several sensors installed in the field to collect the data and send the data for a server, and then the user can go to the server via a user application to make decisions. The problem is most of smart solutions imported from developed country doesn't fit well in Cape Verde. Why? First, because we're not a developing country. Then, because Cape Verde is an archipelago with mountainous islands, and where most interesting areas are far from each other and mostly located in rural areas with little or no infrastructure installed, which makes it difficult to communicate over longer distance and the power supply the sensors. Because imagine if you have a large area to monitor, if you have sensors that can communicate for long distance, you don't need to put many sensors there, just a few sensors. So we need to balance between the sensors, the data that we want, and also the cost from the solution, because we need to have a low-cost solution that can be used for everyone. So in this project, we propose to study the feasibility of implementing wireless sensor network in Cape Verde and what adjustments should be made. The investigation will focus on answer 4 questions. What is the best solution to power supply the sensor nodes in the wireless sensor network? What is technology should we use to establish communication between sensor nodes that can maximize range without increase the cost? Which communications protocol guarantees security? And what can be the contribution of the wireless sensor network in priority areas in Cape Verde, such as water and agriculture? With this project, we wanted to bring recommendations for wireless sensor network implementation in Cape Verde regarding to, oh, sorry guys, I didn't move the slides. So in this project, we want to bring a recommendation for wireless sensor network implementation in Cape Verde regards to technology, communications protocols, and power supply systems to foster new applications. We want also to have a smart water management system that can inform the user or the provider about the quality and availability of water. Could be locally on a monitor or could be through on web applications. And we want also to create a smart agriculture ecosystem where we can monitor soil parameters and weather conditions and trigger irrigations according to water availability and irrigation needs. Although with this project, with these systems, we are moving toward digital transformation and create innovative solutions. the user will continue to have the power of decision making. This is more a kind of the model we want to build, but then we decide which sensor we use for water, drink, and which sensor we use for smart agriculture. We have many challenges to overcome regarding on low-cost technology sensors and low-cost communications protocols, strong and low bias data set for artificial intelligence models, and also we need to manage the community engagement. However, with the engagement of the users, stakeholders, government, and research, this will be a reality in the near future. Okay, good. So this was an overview of my project. We must thank our sponsor and collaborators. Thank you for your attention and feel free to reach me.
Yes. Yeah, thank you very much, Semedo, for that great presentation. I think now our last presenter, last but not least, Bessie, you have the floor. Please.
My slide.
Can you remove
Afternoon, everyone. My name is Bessie Malila. I'm a junior research fellow at the University of Cape Town, and my project is focusing on developing a 5G, 6G digital health infrastructure for testing and validating digital health applications. Okay, the aim of my project is to implement an infrastructure that can be used by researchers, not only in South Africa, but in Africa as a general, for testing and validating their applications. There's a lot of digital health applications and services being developed, especially by young innovators. But most of these solutions, there is no proper platforms for validating and evaluating, especially on the clinical side or for devices as well as mobile health applications. So this project is designed to create a platform that these innovators can use for testing and validating their solutions. Through this project, we also aim to develop capacity for biomedical engineering in Africa. The project will be implemented through master's and PhD projects for students from across Africa. The project is motivated by a high burden of disease in Africa. We know malaria, TB, HIV, those are ravaging health systems in African countries. There's also limited access to healthcare services for rural, remote, and underserved communities. The project is also motivated to develop digital health solutions by the increasing network coverage enabled by mobile networks, as well as the improved network performance expected from 5G and 6G technologies. There's also need, according to the World Health Organization, to build the efficacy, safety, and cost efficiency, to build evidence for efficacy, safety, and cost efficiency of digital health solutions. There's a lot of digital health solutions being developed, but according to the World Health Organization, there is no evidence of how safe these solutions are or how effective they are. Although a lot of solutions have been commercialized, there is no published evidence. So the project is to create a platform where we can actually validate some of these technologies and publish work and that's creating the required evidence. So when we formulated this project, we were looking at what has been happening around the globe. Like Australia is a leading country in digital health and telemedicine because of their sparsely populated, the country is sparsely populated, and access to health services for those people in remote areas is very limited. So as far back as the 1800s, Australia was one of the first countries to develop a telemedicine solution, which was a telesurgery implemented, which was done by a postal clerk through the guidance of a qualified surgeon, which was about thousands of kilometers away. So that was the first telemedicine project in Australia. And at the moment, Australia launched, they've realized the importance of digital health solutions. And so in 2018, the government launched their Going Digital project to deliver a healthier Australia. And they want to use digital technologies to enhance the delivery of healthcare systems. One of the projects also ongoing in Europe, Finland is one of the leaders or emerging leaders in digital health solutions. And recently I made a research visit to Oulu University in Finland. And I had the opportunity to see how they have implemented a digital health infrastructure using 5G technologies. And currently, the university is actually leading research in 6G technologies to meet the UN SDG goal of 2030 for a health for all by 2030. Finland, apparently, they are almost like in the same position as Africa. The country, the population is about 5 million, but very sparsely populated as well. So they want to make use of, to take advantage of digital solutions to address the issue of access to healthcare. To their healthcare system. And also there's also a lot of ongoing research regarding collection of physiological information. So what I realize is that like the government is aware of the health condition of every citizen, which was quite very interesting. And in Africa, we can also leverage on digital technologies to also gather data that can help predict the spread of diseases and also prevent deterioration of health conditions that can be prevented. In the UK, there is the NHS, which is the provider which is responsible for providing health services. They also launched in 2016 a digital health test beds project. So what are we doing in Africa? I tried to look in literature. I couldn't come across any platform that is designed to provide such services. So we hoping that our project will be the first in Africa, and a lot of the countries in Africa will leverage on this digital health test bed. Okay, so that's I'm based at UCT. So this we are developing this infrastructure at the University of Cape Town from the Faculty of Health Sciences in the Division of Biomedical Engineering. So we've been busy looking, I'm working in collaboration with researchers from electrical engineering who are experts in 5G technologies. We are also collaborating with doctors from the Groote Schuur Hospital. They are the ones that also help us identify some of the challenges that we can use digital technology to solve those challenges. So on the diagram, we are basically focusing on 4 domains of the infrastructure development. So the AccessNet, the data acquisition domain, that's the domain where medical devices are used to acquire health information. So we have identified, at the moment, we are working on 4 projects: latent TB screening, a teleaudiology screening for a teleaudiology system for hearing screening, and a telehaptic system, which can be applied in remote surgery, and a tele-ultrasound system for sharing of ultrasound images remotely. And then on the access network domain, this is where we are seeing the implementation of 5G technologies for acquisition of big data, use of artificial intelligence for processing health data on the edge of the network or closer to the user. And then the core network, we are focusing on using open source technologies to implement 5G networks. So that part of the network, we also realized all the universities, they are actually using open source technology to implement 5G systems. So this is one of the advantages of which is coming with the new technologies, where yourself and myself can actually now implement a 5G network on your laptop. Then you get like off-the-shelf devices to provide the wireless connectivity. And then on the data access and retrieval domain, that's where we have our data either stored. Once accessed from the data acquisition domain, the data can be stored in the cloud, or it can be sent to hospitals and clinics. So some of the projects that we are working on, the first one is the telehaptic system. Where I have a master's student who is now writing up her thesis, and she is expected to graduate in July. We have 2 papers, conference papers accepted on this project, IEEE conferences, international conferences. And this project is designed to aid doctors in the surgery to provide remote services. So one of the challenges that has been identified by doctors is that in the case where we want to implement remote surgery, you can use a robot, or you can use another, maybe not a skilled professional at the other end. But if they want to assist remotely, they need to sense, to differentiate between bone, fluids, and tissue. So with the telehaptic system, it allows to send these senses of touch remotely. So with 5G technologies, we expect this. We expect one of the key requirements for such technologies is the network has to be very reliable. In technical terms, 5G technologies, we refer this as ultra reliable network. So 5G and 6G can enable this. So we just need to develop the system. So on the other end of the system is the robot, which we assume would be the other end of the system, will be on the other end of the system. The next project is the image-based latent TB screening project, where we are using mobile phones to take an image of what is called the induration during latent TB screening. So we using machine learning and AI algorithms to process these images towards aiding the diagnosis of latent TB. We are moving towards hyperspectral imaging, where with the mobile phone, we are taking normal 2D images, but with hyperspectral imaging, we are looking at using spectral signatures of the TST induration, and to determine, we want to see if we can give a diagnostic result or get a diagnostic result from the spectral images. The last project we're working on is the virtual clinic. We were approached by the South African Square Kilometer Area Project. During COVID, their workers, where the location is about 600 kilometers from Cape Town and about 400 kilometers from Kimberley. So these people during COVID, they were isolated, and this is like an international cohort of engineers. So they were concerned that in events of emergencies, they can't access the healthcare system. So they approached us to develop a virtual clinic solution for them. And I've got a master's student working on the project now. So the idea is to have a patient a patient, okay, what has happened? Okay. So okay, all right. So we have a patient visiting the clinic. They interact with the nurse, who then connects them with a doctor. The doctor does the diagnosis and offers a prescription. So this project, we are expecting to start working on it in the coming year. So some of the projects that we are looking to implement, the concept of 5G smart hospitals, and also we to address the issue of security in healthcare systems, we also investigating blockchain technology. So what do we need for this project? We realized when we visited Olu University that there is a strong partnership between government, industry, and innovation companies, and also for us to build a sustainable business model where we can have innovators coming in, we test their solutions and they pay, then we can actually then create a sustainable business model. So towards job creation for the youth in South Africa and also over the continent. So that's all. Thank you so much.
Yeah, you'll agree with me that we have had very interesting presentation this afternoon, and now it's time for question and answers. So I hope our participants who presented online are also still there, and we'll now open the floor for questions to the presenters. We had 6 presenters, starting with Emna, all the way up to Bessie. If you can remember their presentations, please raise your hand. And if you are online also, I'll be able to see your hand there for now the question and answer time. Right. Your name and organization. Yeah, wait for the microphone. No. Put it on. Yeah.
Yeah. I'm Getachew. I'm a RISE fellow from Ethiopia.
Mm-hmm.
So my question is for the last presenter, for Bessie. So thank you, Bessie, for the nice presentation. I want to ask on the last point that you said one of your projects is intending to identify latent TB with AI. So how is it possible for the latent TB? I guess that the smear is negative. They are smear negative usually. And if it is smear positive, then how is it possible to differentiate between the smear positive of a latent TB individual and an active TB patient? Is that the bacilli are different, or really I want to know the detail of this point. Thank you very much.
Thank you for the question. When we are doing the latent TB screening project, we are focusing on patients that are not TB active. They are not known. We're actually focusing on HIV positive patients that where if they get active TB, it can be fatal. So the idea is to focus on those patients, HIV positive patients who do not have active TB.
Any other? So from the online participants, I don't see any hand. Are we all okay? This is very rich projects that I think we want to encourage you to continue in that same spirit. It's very, very nice on digital transformation. Any other hand? Can I see? Nobody? Okay, so I think we are going to go to the next session where I'll invite our panelists. I think we have one panelist online. And here we want to just briefly look at the issue of how digital transformation can be used in enhancing social justice in Africa. And we have Bessie here. Yes, there. And Prof. Rita, you're there?
Yes, I'm here. Please.
Yes,
Yes,
I
I'm
can
here.
see.
I'm here.
Yep, wonderful. So I think, do we have Professor Morris? Morris, you there? African Academy of Sciences? No? Okay, then we'll just proceed with the panelists who are here with us, together with Professor Rita. Perhaps I can start with you, Rita?
Sure.
Yes, please. Go ahead.
Okay. Do you have a particular question or can just?
We just want to see how this digital transformation can be used in enhancing social justice in Africa. I think this is just a general question for all of us.
Okay, thank you. Thank you. I'm happy to be here again. I remember the first time I spoke, I didn't introduce myself, but my name is Rita Oji. I'm from Dalhousie University and the Canada Research Chair here, originally from Nigeria. I'm also the Vice President of Africa Digital Society. So talking about digital transformation for social justice in Africa, like I spoke in my first time, like there are three main ways that injustice manifests themselves in Africa. The first one is the political inequality. The second one is the social inequality. And the last one is economic inequality. Right. And, you know, as I mentioned during my closing remark, it's come to a level right now that we cannot say that investment in technology is optional. For Africa to move forward, it really needs to invest massively in technology infrastructure and massively, again, in the development of its young population. So how is this happening? Let me pick on one of these main manifestations of digital social injustice, which is economic inequality. Like I said before, majority of Africans are young population, and most of them, up to half of them, are either unemployed or underemployed. That is massive resources being wasted. So most of the youth waste their productive years doing nothing. It is just like a ticking bomb. And this age and time where employment has no limit. You can be in Africa and be working for America. You can be in Africa and be working anywhere in the world. What you need is that digital skill. Do we have the appropriate digital skill, the environment, the infrastructure to engage these young people? They really do not need to basically get work in Africa. And most importantly, they do not actually need to look for work if they actually skilled enough, especially in the emerging technology like AI, Internet of Things, robotics, 3Ds, and other things. Just in this past decade or the past year, people working as freelancer, that is sitting at your home and doing random jobs, you're not employed by anybody, generated trillions of dollars in working. Most young generation are actually opting to be freelancer. That's where you have freedom of your time. You control yourself, what you want to do, what you don't want to do. It generated massive income for youths across the globe. But how do people in Africa tap into this to close that gap in economic earning power? They can't unless we have that digital skill, digital infrastructure that is affordable, that everybody can actually tap into. So talking about the economy and the solution, I kind of said that there are three main ways or three steps that the government can take to actually begin to close this gap. Leaving this up to the private organization is no longer a solution, because what happens is that they create the infrastructure and it becomes who can buy it, who has the purchasing power, who can pay more, right? I remember being in Nigeria, and also where you have in the remote villages, you don't actually have access to the broadband. Why can't we do that? Because they don't have the return on investment by going to install these things in the village. So the best the government can do is either the government provide the services or they do private-public partnership, more like what is happening in the West, what is happening in places like India, and make this access to things like internet, broadband data, and everything accessible to everybody. They democratize it. That means they make it accessible, affordable, and available. That's actually what India did. And right now, when you come to the West, majority of people working in most of the tech jobs are Indians. And they are not necessarily resident in the country. Some of them are back home and doing it. But this, you cannot take advantage of global opportunities unless you have tech skill. And considering again what I said, that it is no longer an option that you either like it or you don't like it. You have already seen what happened during the COVID. Most of our schools in Africa were closed down. It was evident that we lack that infrastructure to carry on. And it is not like we like it or we don't like it. So since it has come to this, that most of the jobs in America, or what is driving American economy right now, is majorly investment in tech. Why can't Africa actually invest more in tech, develop its young population through tech skills? And one of the practical ways it can be done is one, universities can actually be equipped to the extent that anybody that passed through the university will come out with a tangible tech skill, irrespective of the course you studied. I remember, I did my fourth degree in Nigeria, and I remember going to the university studying computer science that I probably had access to my own personal computer in my final year, right? Most of what I eventually became is what I tasked myself I want to be. I learned it myself and got that technical skill myself. But does it really have to be that way? No, it doesn't. And I'm not even talking about people that are studying tech as a course in the university. I'm talking about everybody passing through the university should actually come out with technical proficiency in one way or the other. In that way, it goes on to reduce the first problem we already have, which is unemployment. Because when you are technically inclined, you can work anywhere. People do not have to work in their nation. So you can actually create jobs. We already see it in the massive explosion of startups, tech startups in Africa, especially around the fintech and stuff like that. Paystack a recent startup actually got sold in around 2 million, and had other youngsters that founded a startup within 2 to 10 years, they were selling it in millions of dollars. And these are just people holding first degree. That tells you that these youngsters have massive talents that are waiting to be harnessed. And if appropriate environment backed up with the right policy is provided, Africa will be on its way to being the global leaders. Because our major strength is our young population. Why the West battle with the old population, right? The aging population. We are having that opposite problem. We have a lot of young population who, unfortunately, at this moment, tend to be, most of them are dependent on their parents. It is a bit saddening that people finish from university and come back and still depend on their parents to make a living. Then that's why Africa is said to have massive number of dependents and reduction in per capita income of a family. But if these digital skills and they are actually provided through digitization, the economic inequality will not only be reduced, but Africa will be on its way to being a global leader. both in economy and other parts of the developmental milestones that needs to place a nation on its way. I think I can see that it seems my time, is up. I will stop it here. Thank you.
Oh, yeah, thank you very much, Professor Rita, for those very useful insights. And we want to thank you for giving those inputs to this particular session of the panelists. Thank you very much for those very wonderful insights. Now I want to move on to Emna.
Thank you. So I'm Emna Hriga. I have already presented myself. I'm an Arise Fellow and a scientist in Institut Pasteur of Tunis in Tunisia. And I'm a bioinformatician and a data scientist. So mainly what I do is work with science, with data, and analyze it in order to bring new insights on new technologies based on computational approaches. And I'm very glad to be part of this panel because as a data advocate that I am, I will never stress enough, as already Professor Rita said, it's very important now for our countries in Africa to, appropriate all these digital skills and technologies in order to develop our own technologies that are done for our own good. So it doesn't matter what type of application are there, was it health, education, water, food, or anything else. It is very important to, being in the master of our destiny through gaining the knowledge and the skills through youth, but also being able to use all these technologies in order to gather data and gain insights on our own situations. So most of the time, all the technology that we are importing from the developing countries are based on models that are based on their own data, on things, how things are going in their own countries. So through Sonia's presentation, we have seen how, important one model to another from one country to another is not always working. So this case was obvious, but most of the time things are less obvious than that. And we are not able to see to which extent one digital solution or technology is really suitable for our society, for our youth, for our social model. So it's at the same time, the same thing also in health. Now the whole world is moving forward to precision medicine, for example, but all these type of models are built on genomics data and health data that is based in developing countries, US, Canada, UK, Europe, and so on. And most of the medications or the recommendation that comes out of there are of no good to the African populations. And this is a fact today. So we are now very lagging behind on identifying what is going on in our own countries and on our own continent. And it's very important to take the time to understand, collect data, and analyze them in order to either adapt all these technologies to our own needs or develop the technologies that suit us the best. So I think that digital transformation, being able to implement all the technologies that would make our life more digital, is not just about developing technologies like, mobile phones or, gadgets. It's more about really being able to have all these aspects of the data that can be defined in our society and how things are going on in our own countries in order to be better in control of what needs to be done, to have data enough to implement data-based, evidence-based approaches. So I think that's one of the most important steps towards a better social justice in Africa through digital transformation. Thank you.
Yeah, thank you very much for those insights. Now let's hear our last panelist. You can also give us a take-home message because time is not on our side. But I think let's hear from you.
Okay, thank you very much. I'm Besmalila from my previous introduction. I'm a junior research fellow at the University of Cape Town.
Yeah.
My background is electrical engineering. I did my PhD in communications engineering and then my postdoc in biomedical engineering. Why? I've worked in industry for more than 15 years before I went to do my postdoctoral studies. And I realized that all the time I was developing technologies, was like in the office all the time, going into the labs, going into the field, implementing technologies based on what the customer was requesting. But then I asked myself, but how am I contributing to social justice as I know it now? But my concern was, how are these technologies really benefiting the poorest of the poor? Because most of the solutions, I worked in the internet and data technologies division at one of the mobile network operators, and our solutions were focused on providing services for banks and big corporate companies. But I couldn't see how I could contribute to the poorest of the poor with my knowledge and skills. So I thought if I go to biomedical engineering, I'll go into the health sector and use my skills and knowledge to contribute towards improving healthcare delivery using technologies. So my research focus is actually on digital, the use of digital technologies to transform healthcare systems. And we are doing that through developing technologies and solutions for disease diagnosis, technologies for distribution of health information. We saw during the COVID pandemic, everyone went digital. There was no access to healthcare. Access to healthcare was very limited. And even those that could access it was scary to go to the hospital. So that digital technology bridged that gap. People could contact their doctors for medication. They could receive SMSs from the clinics to say your chronic medication is now ready, please come and collect. So there is a lot of drive on, it was slow initially using digital technologies in the health sector because of security issues, issues regarding government regulations. But through the COVID, almost every government just trashed those regulations and says, please provide health services in any way you can. So when we look at social justice, we're looking at access to education. What can we do? How can we use technologies to increase access to education? Because without education, you can't get employed, you can't get a good job. Excuse me. No, I've got my order. Thank you so much. Sorry about that.
No more.
So with digital transformation, the World Health Organization is driving that adoption of digital technologies, and they published the global strategy on digital strategy, the global strategy on digital health, which was aimed at saying if countries adopt digital technologies, we will help you to implement, we'll provide you with finance, we will train the nurses with digital skills. But when we look at other sectors like education, they are still lacking the drivers of social justice. Those that drive for social justice, they don't have power. The power rests with government. So other sectors, education is still lacking. If we look at, let me quickly look at my slides. Okay, other sectors lacking, agriculture. The vast population of African, we rely on agriculture for income. There is no application of digital technologies in agriculture. It's still very limited. If you also look at climate change, sensors that can be used in agriculture to determine soil moisture. Other advanced countries are now looking at using drones to scan through fields to detect diseases in fruits and other crops. And if we look at the refugee crisis in Africa, how can we use digital technologies? Because once you are a refugee, you are disempowered, you have no access to health, you have no identity, you have no access to social services. How do we track these refugees? How can we use technologies to improve their access to social services and still maintain that social equality? One problem may be very prevalent in the USA of gun violence, because it's reported in South Africa, there is also a big problem of gun violence. How can we use digital technologies to mitigate the issue of gun violence? Because gun violence does not affect the person who has been shot. It affects the person whose relative has been shot. It affects the communities. And yeah, so digital technologies, we can use them in several sectors in the social arena. So there are opportunities. Enabling technologies, quickly, I can see the chair is now standing. Enabling technologies, robotics in agriculture and health, IoT sensors in health and agriculture as well, data analytics, machine learning, artificial intelligence in health and agriculture, 3D printing for spare parts of mechanical machines in agriculture. If you need a hoe, can I 3D print a hoe for okay.
So there's a lot of use.
A lot of uses. We can 3D print a lot of things that can be very useful for people in the rural areas, instead of going to a factory, to a manufacturer to get these devices. Also,
parting shots, the last.
Okay,
Yes.
drones for surveillance, augmented and virtual reality for training healthcare workers and agriculture and education, blockchain technology. We can't talk of digital transformation without security. Security is costing a lot of money. So we need blockchain technology and 5G and 6G technologies as enablers towards the 2030 UN SDGs. Thank you very much.
I know you have quite a lot to say about digital technology, but can we have contributions from the floor, just 2 or 3 minutes? Is there anybody? Yes.
Thank you so much for the insights about the social justice. But I wonder, for the technology in Africa is not that cheap. For example, if you have this refugee, how will you, with the how will they get access to the technology, or how will you track them?
Yeah. I think you talked about refugees.
Yeah, okay. When it comes to access to technologies, there is a project that I read online in Europe where they are saying just not a smartphone, a normal phone, your 2G phone with not a smartphone, for SMS can enable sharing of information among refugees. They can get access from funds because the UN provides funding for refugees. They can use digital banking to send them SMSs, to send them money. So it's not very expensive technology.
Yeah, I think we are, as she has explained, I think we are in the right direction in terms of the use of digital technology in almost all sectors. So any other? Yes, I can see your hand.
Can I add to?
Yes, please. Oh, sorry. Yes, please. You can go ahead. But there was a hand somewhere I saw. But go ahead, please. Who was that? For somebody online, I think.
Oh yeah, I was actually going to add to the question that was the first one, but it's okay.
Go ahead, please.
Okay, I was just gonna add a quick one-liner to that question. You know, it's actually not that possible when you talk about 3D for agriculture and making it available to the rural farmers and everybody, irrespective of your economic status and class, will never happen as an individual project. And that's why I would say that the government would have to step in to provide the infrastructure and then the necessary subsidy that needs to make this technology democratized. It is the democratizing of the technology that will make it accessible to everyone who might need it, making it affordable, available, and accessible. So it's no longer dependent on how much you have in your purse, but because the government knows that this would help in driving the economy, it will invest massively on it, and that will reduce the costs of getting access to it and make it available to anyone who would need it. Thank you.
Yeah, thank you very much. We have somebody with a microphone. Can we hear your reactions? And then I see your hand up. And then after that, we close the session. We need to go for a break. Yeah.
Thank you very much for the insightful presentations. I've also learned a lot in terms of digital technologies. So what is your view in terms of integrating artificial intelligence in climate security? And is there an opportunity for making sure that these digital technologies are also mainstreamed into the school curriculum at an early age, not only waiting until we reach a stage where you are doing your engineering, your biomedical sciences, and so forth? Any efforts towards that? Thank you.
I think there was a presentation about curriculum from Malawi, was it? Oh, it was online, was it?
Yes.
Do you want to react? Yeah.
Well, I think that if we talk about schools, it is really quite relying on the governments and what type of infrastructure that can be installed in order to make this accessible to everyone. This is a big problem in the terms of this is not relying about researchers or like innovators trying to develop something new. It is more of research implementation and understanding how with little mean, if this is the case in most of the rural parts of Africa or poor parts of the continent, how to make sure that everyone is able to access technology. So I'm aware of a lot of initiatives in order to democratize the access to that and leverage literacy in terms of computers and coding at early stages. But I think that it's going to take a little bit longer than in some parts of the continent than other in order really to be able to reach out everyone in that term.
I think we want now to almost close the session, but there was a hand up here.
Thank you very much. And thanks to the presenters for wonderful presentations. I think mine is much more general, and it's the issue of security. And it's a double-edged question in that I think with technology comes the challenge of perhaps, among others, security at the personal level and at the infrastructure level. And I'm just saying this because a lot of companies who invest in the infrastructure, especially mobile telephony, we find that it has been secondarily pillaged, mainly for, of course, wires or copper or whatever. And that's become a very huge problem. So I'm just asking myself, how do we ensure, as you enable rapid infrastructure development, that security of that infrastructure for its actual use is seen, because it's undermined by, say, maybe basic theft, which then destroys whole networks. And then secondly, the security of the person. And I'm speaking now more to the issue of telemedicine, in that with the increased challenges of hacking, how do we ensure that, especially for public repositories, that data is kept safe for learners, that information is safe, especially given that there seems to be quite a lax attitude to, I say, long-term solutions and storage for data. So I'm just worried that at some point, how do we ensure that the longevity and security of data, such huge data that the continent has, remains secure through time? Thank you very much.
They can react very quickly on that, and then we close it out. Maybe just a minute and a minute.
Okay, thank you very much for the question. Yeah, like I said, I think in my earlier presentation that one of the problems that have hampered adoption of digital solutions in the healthcare system is that of security and safety of data. So those countries, like I talked of Finland, they invest heavily in security. The governments need to invest in capacity for securing digital systems. With regards to infrastructure, use of digital technologies, in Finland, they are using drones, not to protect the infrastructure, but to monitor the physical, technical problems on their railway lines. They use drones to actually monitor that. But maybe in Africa, where there's issues of vandalism of infrastructure, drones can also be used for that. With regards to personal health, personal security, blockchain technologies and other security solutions for distributed infrastructures are being employed everywhere. It's not an African problem, but it's a global problem. Thank you so much.
Yeah, I think I'm just going to add a small thing about what Bessie says, because this is the main approach to have. If you would like to go digital, you need to have the whole package. It's the infrastructure, like physical infrastructure, then you have the softwares, but you also need the security aspects to be controlled. So you cannot emphasize on one aspect and leave the others lagging behind. Otherwise, you're kind of using all your efforts. So it all comes in one package.
Yeah, I think with that, we want now to bring a close to this particular session. Can we give a round of applause to the panelists and also the people who presented? Thank you very much. We can break for tea and then we come back maybe after 15 minutes for the next session, session 9. Yeah, we have a short break and then we come back, and this will be session 10. And I think that will be the last session for us this afternoon. And we'll see you again in 15 minutes. Thank you very much, and enjoy your coffee.